Michael Rausch live in Peoria, Arizona. Carla is a hairdresser. Michael is a bank manager. And they have two fun-loving boys, Ethan and Emmett. But family life hasn't always been smooth.
Emmett was born at 28 weeks, 2 pounds, 13 ounces. He spent his first 3 months of his life in the hospital.
He was small, as most preemies are, but he was reaching most of his developmental milestones. I was very happy.
A year later, Carla and Michael plan a party for Emmett's first birthday.
The morning of the birthday party, Emmett was fussy, so I took his temp, and sure enough, he had 102 fever. When Emmett gets a fever, it's always more alarming to me with him being a premature baby.
So while Carla prepares for the birthday party, Michael takes Emmett to urgent care.
The doctor listened to his heart and his breathing. The doctor just told us that he probably just had some kind of viral infection. She just pretty much told us to keep a good eye on him.
Much to his relief, Michael takes Emmett home. There, Carla gives the boy some children's acetaminophen, and the family celebrates his first birthday. But the next morning, Carla notices something is amiss with her son.
I'd try feeding him like his fruit in the morning. He would take a bite and then get angry and cough it up and cry. I decided to give him some electrolyte fluid in a bottle just to keep him hydrated. He took it a little bit, but again would resist it. And this wasn't normal for Emmett.
The next day, Emmett develops another symptom.
He started producing a cough. His cough at first sounded like an average cough, but as the day progressed, it got deeper and heavier. I thought that there was something more serious than a cold going on.
Later that day, Emmett's cough worsens.
He looked like he was straining to cough. It looked like it was painful, so that was also alarming to me. I started questioning, should I go into the doctor again? Should I not? It's only been about 24 hours. You know, the doctor just saw him. They know what they're doing, you know. So I started battling with that internal feelings of, am I being paranoid or is there something really wrong? It's very difficult. You're battling with, you know, what you think is logic and then what you're feeling inside as a parent.
That night, something shocking happens.
So that evening I was rocking Emmett as I normally do right before he goes to bed and singing some songs to him, and all of a sudden he's coughing up yellowish tinge colored mucus. It was very thick, and anytime he coughed, and this was beginning to be more frequent within minutes of each other, this secretions were coming more and more. And with him not eating, of course, now I'm worried about him being dehydrated. And this, I could see on his face the pain that it was creating each time he took a breath in to let out a cough. I thought that there was something more serious than a cold going on, possibly croup or bronchitis or something. And again, because Emmett was a premature, it's scary when things are infecting his airway. He was really struggling to get this yucky mucus out of his fragile little body.
Carla and Michael decide to wait it out. But it turns out to be a long night.
After we laid him down to bed, he continued coughing. So I held him that night just to keep him sitting up elevated so that he wouldn't aspirate on his mucus. I just was constantly holding him and patting his back and doing anything I could do to console him. I was feeling very scared, terrified. Seeing him rapidly go downhill quickly was terrifying to me. I was trying to do everything that I knew how to do as a mom, but it was scary, and I wished everything I could to take that pain away from him.
So Carla decides to take Emmett to the doctor.
As I'm driving, I'm focused on the road. Then I began to hear him cough. It sounded awful. I looked back, and I noticed that Emmett had bright red blood all over his chin and running down his shirt. It was terrifying. It looked like something was inflicting pain inside of him.
Immediately, Carla rushes Emmett to the nearest hospital.
ER physician hooked him up to all the monitors to watch his respiratory rate and his pulse saturation throughout his body, and decides to put him on a breathing treatment.
Doctors use a nebulizer to open Emmett's air passages. But after 30 minutes of treatment, Emmett's oxygen levels dip and his heart rate skyrockets.
The physician was concerned that he had a possible pneumonia.
Pneumonia is a lung infection that causes the air sacs to fill up with fluid, leading to difficulty in breathing. In children and those with compromised immune systems, it can be fatal.
I was getting nervous because pneumonia was going to mean hospitalization.
To confirm the diagnosis, doctors prepare Emmett for a chest x-ray.
At that moment, I was just hoping that we would get an answer.
The technician performs the x-rays and shows Carla the scan. To their surprise, Emmett's lungs are clear, but there is something in the boy's esophagus.
I was shocked. Looked humongous. All I remember is it just shining right back at me in the x-ray. It was terrifying.
The technician sends Carla and Emmett to the triage room, while the doctor and radiologist analyze the x-ray. Minutes later, the doctor comes in with a horrifying conclusion.
The physician said that it was very dangerous, and they already had an ambulance on the way to take us to the children's hospital. The radiologist identified a serial number on the object. Emmett had swallowed a button battery.
In Emmett's esophagus, bodily fluids surrounded the battery, triggering an electrical current. This current generates hydroxide, a toxic chemical that can cause serious tissue burns after as little as 2 hours of exposure. For about 2 days, the chemical has burned through the esophagus all the way into Emmett's windpipe.
I remember just saying, oh my gosh, and the look on Emmett's face was just painful. It was almost defeat. It's still so real, sorry.
Every year in the United States, more than 3,500 people of all ages swallow button batteries. And in the past 6 years, at least 9 people have died as a result.
I called my husband immediately and told him what was going on.
I dropped everything at work and rushed to the hospital. I was frantic. I was just really scared.
Paramedics rush Emmett to Phoenix Children's Hospital. There, they meet with pediatric trauma surgeon Dr. Craig Egan.
Batteries can burn through the esophagus, and then it can burn through the aorta, in which case, then the patient could bleed to death.
Dr. Egan immediately takes the boy into pediatric surgery, leaving Michael and Carla in the waiting room.
We were really scared at that point. We were in tears. It was a really emotional time.
In the OR, Dr. Egan directs an endoscopic camera down Emmett's esophagus. What he sees doesn't look good.
The inside of the esophagus literally looks like somebody had put a firecracker in there. The battery was stuck to the tissues inside the esophagus because of the burn.
For an hour, Dr. Egan delicately wrestles with the foreign object.
The battery was only a few millimeters away from the aorta, so we dodged a bullet.
But Emmett's situation is still dire. The hole in his esophagus is allowing the saliva and gastric acid to enter his lungs, which can be fatal. Dr. Egan wheels Emmett to ICU to put him on a ventilator and breaks the bad news to the family.
It's devastating. I wasn't ready to lose him yet.
I was trying to be the comforting husband, but it was tough. It's hard to be that when he's also your little baby and he's struggling. I was pretty scared too.
When the operation is over, Michael and Carla walk into the ICU to see their boy.
Carla and I were crying. It was tough to see that our son was suffering so bad.
I told him he needed to fight. We were going to fight with him. I felt this anger with myself. How did I not know my child got a hold of a button battery? I don't even remember purchasing one. Where did it come from? After going home and looking around my house, I saw a remote control to our DVD player with the back off. What I believed happened is the back fell off, and Emmett put the batteries to his mouth, like all kids put things to their mouths. After doing some research, we found that the batteries kind of have a tingling sensation when put in the mouth. I believe he just kind of liked the feeling of the tingling and kept sucking on it and ultimately swallowed it. I never imagined that a battery could do this much damage.
Later that night, Carla is with Emmett in the ICU.
Emmett's coughing and coughing, and all of a sudden you can see his chest tighten, and he is panicking. I can see it in his eyes. He's screaming at me, but he can't talk. And the next thing I know, his hand goes up to his breathing tube, and he pulls it out, and his numbers go 0. He's not breathing, and his heart rate stops. People rush in, hollering at each other, trying to figure out what's going on. Is this it? Is this where I'm going to lose my child?
When 1-year-old Emmett Rausch swallowed a button battery, it burned a hole in his esophagus, almost killing him. In the OR, surgeons removed the battery, but the night after the operation, his vitals flatline.
He's not breathing, and his heart rate stops. Is this it? Is this where I'm going to lose my child?
Doctors rush to replace Emmett's breathing tube, and his condition stabilizes.
As soon as I could hear the beeping of his heart rate again, is when I was able to take a breath again and realize, okay, he's okay.
But the relief is short-lived. 2 weeks later, Dr. Egan takes Emmett into surgery to reconstruct the hole in his esophagus, but the operation is unsuccessful. To prevent gastric acids from leaking into his lungs, Dr. Egan cuts out 2 inches of the baby's esophagus and reroutes it out the side of his neck.
One of the hardest things I've ever seen is Emmett's body. After that, he didn't look like Emmett.
I just felt like I was hit by a truck. We were just devastated. It was heartbreaking for us.
To keep the ailing boy alive, doctors place a feeding tube in his stomach, allowing the inflammation in his chest to subside. 5 months later, doctors are able to repair Emmett's esophagus. But it isn't a complete success. Emmett's esophagus repeatedly tears as he endures 17 more surgeries over 6 more months. Today, Emmett is still recovering from the damage done by the button battery.
The doctors don't really know what the long-term prognosis is. The hope is to get everything healed and then get him to start swallowing and being able to take some food by mouth.
He, for some reason, is supposed to be here, and we will continue to fight with him and tell him to keep fighting. There's a purpose for him to being here, and as his parents, we're going to try to help him fulfill that.
As more electronic devices that use button batteries enter the market, the incidence of people ingesting those batteries also increases. To prevent children from accidentally ingesting them, keep button batteries out of their reach. And make sure that the battery compartments in any electronic devices that they have access to are securely fastened. If there's any suspicion that someone may have swallowed a button battery, seek immediate medical attention.